changing it to tartan track, track lane, and we are converting the grass to astroturf. We hope that before the end of October it will be completed. The uncovered area, we are covering it up so that it will be a standard stadium where you can hold national competition. It must be an 8-track lane and astroturf, and the seats will also be covered. We are also, because of the importance of sports, not only as a way of engaging the youth, it is also, sport has an economy of its own. So we are building a new stadium in Oluchi, we are building a new stadium in Ore, we are rehabilitating the stadium in Ikare, and we are doing 1 or 2 swimming pools around the state. We are making the right investment, and the outcome we have had in the last 2 years has been very encouraging.
So in terms of building the stars of tomorrow, I know there's an agency.
Yes, the academy. Yeah, thank you. I even forgot to mention that the Sunshine Academy, that we came second in the short competition nationally. Of course, we believe in building the stars of tomorrow. That is why we have what we call the football agency. And now we have organized competition among these kids all over the state. Almost every weekend, one local government or the other, there's football competition going on among the kids. They get into the hostel over the weekend and play football for some stipends, and they get back to school. The whole idea is to breed future champions right now. We think it's an investment worth making. We don't want to go back.
In the next 2 years, where do you think, where do you hope to bring sports to?
It's incidentally, I was somewhere, I keep saying this, I was somewhere, around the time we came in February 2009, and there was the usual argument about football. I think I was the chairman at the reception, and the compere, the MC, was not talking about the Lagos governor is Man U, the social governor is Chelsea, another one is Arsenal, another one that. And they said, now let us ask Ondo governor, what is your football team? I said, my football team is Ondo State Sunshine Stars. And they just laughed. I said, look, watch out, 2, 3, 4 years, that would be a global commodity. And I think we can get there. I believe that whatever your mind conceives and you're ready to walk and shoot us in that direction, we can get there. Today, Sunshine Football Club, Sunshine Star, it's already well known in Africa, among all footballers in Africa. Our involvement in CAF, we are even, we're in the semi-final now, we get the cup, and in every country in Africa, every football stakeholder in Africa is Sunshine Football Club. So we are on that way. We want to build a global brand. I'm sure 2, 3, 4 years down the line, we will succeed.
Now, with this area of success in sports, we know as a medical doctor, as a former commissioner for health, you have very great interest in health development. What have we done on this?
Well, again, for us, sports, health, education, they're invariably about human capital development. And we take off from the fundamental premise that it is the human mind that can drive development. You have all the natural resources in the world. You don't have appropriate mind that has been schooled, mind that has gone through the right mix of education and physical health, you're not going to go anywhere. So from the beginning, we knew we had to make a lot of investment in the health sector. And we have piloted, we started with the most vulnerable in society. The most vulnerable are the kids and pregnant women. And our homegrown Safe Motherhood program at BA is already already a global brand. It's been recognized, acknowledged, and even recommended as a template for similar in Africa. Our Mother and Child Hospital, the outcome we have gotten in the last 2 years has been superlative, almost incredible. Just about 3 weeks ago, the Nigerian Obstetrics and Gynecology Society, that is Society of Doctors that specialize in women and pregnancy-related issue. In November, they will be decorating me as the honorary fellow of the society, which is a great honor. For them, a BA and Mother and Child is a clear statement that Africa, we can put together a homegrown program with very desirable outcome. I'll be the first governor to honor. They're not honoring me because I'm a medical doctor, but because of what we have in place in the direction of tackling maternal mortality in Nigeria. So in the health sector, we have good records, we have success stories, and we just continuing. We are working on an emergency medical services that will also be a template not only for Nigeria but for Africa. We're almost getting there now. It includes essentially ambulance hospitals, enhanced capacity of designated trauma centers, and call centers, and all of this linked up in a very seamless accident and emergency response mechanism that we're putting together. Routine hospital services, we are rehabilitating our hospitals, improving their infrastructure. We are incentivizing our doctors, getting them to come over, to work in the system. I'm sure we're on the right track. We're on the right track. We're on the right track. A lot of room for improvement. But again, in everything we do, not to give global brands.
But sir, isn't it time that we expand ABA to cover the states?
ABA is being expanded now. It's a pilot. What we have not done actually is to document, but ABA is being expanded. And the new commissioner, when he comes in, one of his very clear mandates is to ensure that we document ABA Plus, the success of ABA Plus. ABA Plus is the scaling up of ABA around the whole state. The results will come out very soon, and whatever we need to retool to ensure that we get better, we continue to get better outcome, we will do that.
Yes, and I see this calls from the people that the fact that we have Mother and Child in Akure, one being constructed in Ondo, that this thing should, at least all the services should have at least one each.
There's no question about that. That is a very legitimate call. We're going to do it. But for the little budgetary hiccup that we had, education by enhanced salaries, we probably would have started the thought. But we're going to take it around every central district, every community. Our goal is that pregnancy will never be less intense again in the state. And we will not look back until we achieve that goal.
Yeah, I remember sometimes ago there was this law in those states that doctors kicked against about their reporting maternal deaths in hospitals.
Because the question of a misunderstanding is called confidential inquiry on maternal death. It is the first in the country, so some people may not be familiar with it. And what we are saying is that anywhere a maternal death occurs, it must be reported. And we say it is a confidential inquiry. You will not, it has nothing to do with whether the practice is right or not. For example, if you are a quack, there are other laws that can deal with you. If you are doing what you're not supposed to be doing, there are other laws. But the confidential inquiry about maternal death is for us to to have a credible database. And what that means is, if it happens in your facility and you don't report it, that is when you will be liable to some sanction as prescribed by the law. There was a little misunderstanding with the doctors initially, but it needs something out. Everybody agrees that we need reliable database. Because you see, we cannot. Let me give you an example of what I'm talking about. When we a baseline survey for our BA, something came out that was very interesting. We found out that only 16% of those who registered in health facilities ended up actual delivering in such facilities. What that means is that we cannot track 84%. So, if for example you are talking of a facility-based maternal mortality rate based on facility computation, you are basing your statistics only on 16%. So we want to capture maternal death wherever, in facility, in faith clinics, in quacks homes. For example, there are a lot of maternity activities taking place in our faith homes, in churches, in all manners of places. And what we are saying, if a death is recorded there, it must be reported so that we can have an inquiry into it. You only are subject to being sanctioned if you don't report it. So there was a little misunderstanding at the beginning, but we're getting things sorted out. And we believe that 1-2 years down the line, we can have a very reliable database on maternal death in Ondo State. And that will be the basis of further planning, scaling up whatever programs we put on ground.
Yeah, the impression was that maybe you were using tactics to check quackery. What are you doing to check quackery?
A lot is being done to check quackery. If you've seen, we are familiar with radio announcement and television recently. The Ministry of Health is closing down a lot of hospitals where the practice is below prescribed standards. They're clamping down on quacks. And most importantly, let me tell you what ultimately we send quacks packing. Ultimately, it's increased in standard and affordability and accessibility of our programs. Today in Akure, mother and child is doing about 25 to 30 deliveries every day. In 1 year and a half, they've done over 1,500 cesarean sections. In Akure, in Ondo State now, 20% of patients come from outside the state. And the knowledge of the quality of service and the affordability, as a matter of fact, the services at Mother and Child Hospital are free of charge. A lot of people would rather go to where you know that it's an ambient environment, nice, beautiful environment, as beautiful as any private hospital in town. You know that the service is second to none, and you pay nothing for it. Nobody will want to visit. It's in Akure now, it's not only the quacks that are complaining, even private, genuine private practitioners are complaining, quote unquote. Ultimately, it is quality, accessible and affordable service. And we send the quacks packing. And if we are down the line, we send them packing because people will have choice.
And by the time you recruit mother and child almost everywhere, how do you hope to sustain them in terms of financing?
You see, one of the great things we have done, that's one of the reasons our bank is excited. Nobody has actually put cost to the care of a pregnant woman. And this is not conjectural now. This is based on empirical data that we have from mother and child. A patch rent is from pregnancy to 6 weeks after delivery. We have found out that when you remove the overhead, that is salaries of workers, it costs only 6,000 naira. With 6,000 naira, you take care of a pregnant woman on 6 weeks after delivery. And what that means is that with result-based financing, I can set up a mother and child hospital. And if I give you 60,000, that's 60,000 naira, I expect 10 deliveries from you. With 600,000 naira, I expect 800 deliveries. That's what you call result-based financing. We are involved in NHIS and this, and I've told my folks that are involved in NHIS, and I've said they should tell this to the HMOs. I don't believe in basing our funding on number of enrollees. Enrollees is just part of the story. I'm more interested in so number of deliveries, so that we can base. And that is why even World Bank now, they have started what they call the result-based financing. And that is why what we did in Mother and Child, giving the figures, establishing it, is the first result-based outcome with financing parameter attached to it that will come out of health services everywhere in Africa. And that is why it may not be as expensive as we used to think. For example now, even the mother and child hospital now, we're trying to reduce from 6,000 to 4,000. And I can tell you we've almost achieved that. Ultimately, we'll bring down the cost to 3,000 without compromising quality of service. In mother and child hospital, drug wastage is almost 0% because we have digitalized drug procurement, disbursement, and it's so easy to get things. We have done task shifting. We've introduced a lot of processes there. You get to mother and child hospital in the morning, you see 500 patients. By 2 p.m., everybody's quiet, everything's done. So, sustainability will continue and always be an issue. Then we have also find out, now to interest you. For a population of 1 million people, tax paying 1 million, per capita health tax of 200 naira will almost be enough to take care of all pregnant women in our society, based on result-based financing, based on the empirical evidence that has come out of mother and child. So I'm not talking theory, I'm talking things we have practicalized that is come out. Now, so for sustainability, there are many options. But I tell you that once we get the financing right, and we get the processes right, it will not be as expensive as we like. Now, 20% of patients come from outside the state. We are about a few months down the line. If you are not registered in Ondo State, and you are not a registered citizen of Ondo State, resident in Ondo State, you probably pay premium for our services. Part of sustainability. Number 2 now, UCH is trying to adopt us as a training center. That will give us some money. That's 1 or 2 senior rangers just left from youth. They spent some time with us to study our processes. We have been designated as a research center by London School of Hygiene. In 1 year, we have earned about $100,000 to $200,000 because of our processes. All of this put together, we will be able to sustain the services of the land child. But we are also thinking of other possibilities of ensuring that what we put on ground and what we hope to put on ground all over the state will be sustainable.
Now, your trip to Washington, the World Bank trip, to where you presented your program. Now, will there be anything from there? Any support?
course, yes, of course, yes, of course, yes. In principle, the World Bank has accepted that they will help us in scaling up. Number two, we started seeing the results. I talked about resolving financing. World Bank has picked 3 states in Nigeria. Ondo State is one of them. This is part of the sustainability. This is part of the fallout of that visit.
So you talked now about the residency card. You have not heard too much about that since.
You will hear about it very soon. We're almost getting there. The interesting thing, that is the truth, this will be the first smart multi-application card ever done. It had its challenges, but I can tell you that we have harvested data under 800,000. We have converted to digital format. We're about them placing the chips on the cards very soon.
Yeah, another leap in the sector is the Ghana Emergency Center.
Yeah.
Because it's a private sector partnership, PPP. People don't really have access to it as they have to mother and child.
Ghana, for me, it's very fulfilling endeavor. We give commitment at the burial of Ghana that we will provide a world-class diagnostic center so that Nigerians can have a place they can say is world-class in terms of diagnosis. A year after Ghana Family's burial, we delivered on that via a PPP. Accessibility, affordability is still a factor. In a PPP, our partners are interested in making money. What we are trying to put in place to complement this is a foundation. We plan to put together a Ghana diagnostic, something like that, diagnostics foundation with a board of trustees that will ensure that those at the lower rung of the society who need the use of those the facilities that cannot afford it get help from the other. That is what we could do.
Another critical sector in those states is education. Yes, we have seen a lot in the new schools, the legal schools. We have seen a lot of the rehabilitation of the old schools. What other areas we want us to
look forward to? You said it all, education, I said it earlier on, very important. I keep saying it, if we want to get out of the weeds, we must make the right investment in education. It's a sector we are interested in revamping. We used to be leaders in the education sector in Nigeria. And I challenge anybody who will say any state in Nigeria was a better performer than Ondo State. And the empirical evidence I always give, which again cannot be controverted, is the fact that the National Merit Award is still one award that's not been politicized, it's not been emphasized, it's not been, what do you call this, the issue of zoning had not gone into it. Of the 60 eminent Nigerians that have won the National Merit Award since it came, 10 of them have come from Ondo State. That is empirical evidence that we were champions in the past. We were champions in the past in education, manpower development in this country. We want to recreate that past. And that's why we're investing massively in education. We're incentivizing our teachers. We're investing heavily in infrastructure. Inspection has been given a prime of place because we have deliberately created a new elite agency for inspection, which we call the Quality Education Assurance Agency. We are playing emphasis on ICT, information and communication technology. We are revamping our curriculum to actually actually reflect the needs of our society. And we are also placing new emphasis on technical education. Those are the areas of emphasis in our education revamp program. And we will continue to drive in this direction. We incentivize our teachers, improving on infrastructure, placing emphasis on inspection, emphasis on ICT, curriculum development, technical education.
Yeah, the mega school concept is very good at yes, but the fear is that maybe the schools will be occupied by children of the palm set, children of commissioners, yes, the poor will have no place.
Those who have that fear should look at our record. When we were building these modern markets, when people saw the quality of markets we were building, everybody said, oh, this is the market for the wife of elite in society. But I tell you, let's start from the Nepa market. There's not one person in Nepa market who is there now who was not displaced on the street. Because we went to the rigorous extent of taking an inventory of all those who occupy this market before we built them. Because we knew that because of the standard of the markets we build, that the elite will want to corner all these markets to themselves. Today, all the markets we are building for the masses. It's not as if we are not under pressure by the elite who want to take over this market, but because we are operating from a fundamental ideological perspective, we will not compromise. We have not compromised. The Mother and Child Hospital, today by choice in Ondo State, and perhaps this is the only state in Nigeria, where in an open maternity ward, the wife of the elite, top elite in society, will be lying next to the wife of a messenger. By choice, we have achieved an unprecedented level of social integration in the Nigeria hospital. Why? Because of the quality of service and because of affordability. Anybody will want to go for what is quality. Those who have money will still want quality. Then those who cannot afford it and see free service and top quality, of course, will go there. We deliberately building these mega schools to bridge the gap between the rungs of the socio-economic ladder in Nigeria and Ondo State. We have found out that the children of, the children of the low socio-economic ladder in society cannot afford competitive education. And so we are building this mega school deliberately, again, as a facility that will be available to children of the elite and children of the low socio-economic ladder in the society. I can assure you that by deliberate policy, we will not allow the elite to take over these mega schools.
There was a time the generation was toying with the idea of setting up science schools.
We were toying with the idea. Thank you very much. We were toying with the idea. We have not crystallized that idea completely, but what we have done also is one, we have started deliberately building science laboratory in some of the schools. Very soon we will commission the satellite science laboratory in St. Louis Secondary School here, and we have built a couple of them. Then there is this Ayedun Resource Center, which we have revamped since we came on board. The Resource Center was an original idea of one of these intervention agencies at the federal level. But since we came on board, PTM. Okay, we have revamped the place and put the place to use. It's a resource center, laboratory facilities that schools can come around and make use of. For now, we are trying to improve on the laboratory capacity of our schools, but ultimately we know that we must have a big bang policy that will address the problem of science education.
So before you came in, sir, you were fond of saying there was a very serious disconnect between the people and the government in the states. Now, I suppose one of the ways of bridging the gap was this 3 Eyes initiative that you work upon.
Yeah.
Now, have you achieved your aim in these areas?
Let me tell you one thing that gives me satisfaction. Is the fact that today in Ondo State, everybody is more conscious about how they get connected with government. People see mother and child and they go there free of charge and they get what and say, wow, is this government all about?
In the cities.